I'm Larry Menti. Welcome back to the Delaware Way. We continue our conversation now with Senator Bethany Hall Long. We've been talking mostly about health care issues. Let's talk about the Narcan. Explain what that is.
Narcan is a form of medication that actually reverses the effect of an opiate. So if you have a heroin overdose, respiratory rate depresses, we want to respond. And what that does is it really, in lay terms, revives the person back. Obviously, it's something you need training. I mean, again, family members or peace officers need to have some type of education because when somebody does come back out of respiratory depression, they can be combative, agitative. Bottom line, parents came to us with their stories, those who lost their wonderful loved ones, to those who came close to losing family. And it is such an inexpensive response in the immediate emergency situation. But, we don't have folks just going out and giving Narcan and letting their significant other or their child go back on the street. The plan is once somebody has that experience, they then are brought to the hospital. They are then admitted and, offered services. So in a way, the Narcan not only revives them in the minute, but it also helps them hopefully enter treatment and enter services that can be offered to them later.
You said offered, and this is where there's been some controversy in other states with Narcan because police officers are administering it. So and sometimes administering it over and over and over to the same person and bringing them back. Should there not be a requirement if a police officer brings you back with Narcan that you must enter a program?
Our police have had to use it very minimally, and we have been lucky. The data, and again, this is a new program, it's new legislation. Perhaps I can come back and talk to you more about it in the future and can track those numbers. You raise a good point. Our response team is great, our EMS and our paramedics, because we are a small state. Very few police do have to administer. And you raise a point that I had asked. And initially, when we crafted this legislation, we did have resistance initially from police. They were concerned. So we made that with Representative Barbieri and myself, we made that an option for police units that wanted to step up. Newcastle County, its executive, they said, hey, we want to do this. And I think we should be monitoring. But at the end of the day, it cost us. Because again, if the person doesn't pass, they often end up in a nursing home, in a ventilator or a vegetative state, and we pay. And for some kids who've come and gave testimony about a parent, the trauma of having a parent who's an addict who collapses in a bathroom, who becomes halfway revived. So it's been, you raise a good point.
Yeah,
about
I get
tracking.
it. I don't think anybody would ever say that a police officer is at a situation and shouldn't save the life. It is trying to improve that life after they come back. So please, as you go through this, come back and talk about it because we only have a couple minutes left and I do want to get to telemedicine that we talked about. You have current legislation. Explain what telemedicine is.
Telehealth. Again, myself, Representative Barbieri in the House, for probably a decade, there's been a movement across the nation for individuals to perhaps have ambulatory issues. Parkinson's disease, the society here in the state of Delaware, very active. In Sussex, they have a number of individuals. There are not specialists in movement disorder in the state. They have to drive to Baltimore, to Philly for services. This will allow them through a computer screen, a TV screen, to actually have a full physical, a patient-doctor relationship. So working with the nurse practitioners, the medical society, the docs, hospital association, we put together a great bill that will provide the insurance coverage, because that was the key. The insurers were not always on board, but they are now, and they recognize the value, because you still have that great patient-doctor, patient-nurse practitioner relationship, but you can do it without the travel cost, the trauma to the individual who perhaps is very ill, or if you have a young child who perhaps is in a desperate situation in a community-based hospital and you need to teleconsult with someone. AI DuPont shared this beautifully at our hearings, the value of this, that they can actually provide consultation that otherwise they couldn't provide.
And the state needed to get involved in this?
Yes, and Medicaid in our state actually was always willing to pay, but our private insurers had some questions. So we made sure it was a Delaware licensed physician. We made sure we put structure in place that would see the benefit. And this is happening nationally. Medicare with our senior and disabled population is also getting into telehealth. Many people think of the big states of Texas or rural and Utah or some state where somebody can't get in the car, but really it comes down to a mobility issue for many families, Parkinson's being the perfect example, where people really could not get services, and you'd have somebody who might be driving themselves who has movement disorder. We had one client in Sussex who was fearful of driving on bridges, so they would drive 4 or 5 hours to see someone. Now this person can stay at home and have the same services provided to them and save actually the insurance company money because they have more compliance, they have more interaction.
It makes it more efficient too.
Yep.
It makes a lot of sense all the way
Yeah.
around. Thank you so much for coming in and talking about this. I appreciate it. Senator Bethany Hall Long from District 10. District 10 again?
Middletown to Newark.
Middletown to Newark. The
Thank
Delaware
you.
Way continues right after this.